Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
First, in age-related macular degeneration, first non-exudative age-related macular degeneration are also called as dry macular degeneration. So, in non-exudative macular degeneration is most commonly seen in almost 90% of cases. Here, the patient has gradual, mild to moderate impairment of vision is seen, which is seen over months to years. Here, the patient will present with drusense are seen along with retinal pigment epithelium atrophy and retinal pigment epithelium detachment is seen along with the drusense. So what are drusense? Drusense are here. These are the atrophied retinal pigment epithelium is seen, which is drusense. Okay, so these drusense are characteristic feature of age-related non-exudative retinal detachment. Actually, in age-related non-exudative or dry retinal detachment, there is no effective treatment. The only treatment which is available is giving the patient low vision aids and the antioxidants. What antioxidants do we give? We give antioxidants like vitamin E, vitamin C, zelutin, lutein, zinc, copper can be given to the patient with non-exudative or dry age-related macular degeneration.
thank you and thank you for watching.